Hello, everyone. Welcome to today's webinar. We're going to be getting started in just a minute. But before we get started, I do want to go ahead and let you know about some upcoming presentations. Next Wednesday, August 20th, we'll be having a presentation on OSHA ergonomics, history, enforcement, and success stories. And that will be with Mark Vargas, CIH, MPH, and the New York, New Jersey Education and Research Center. We'll also have another webinar on Tuesday, October 14th, on evaluating degreaser volatile organic compound, or VOC, exposure in auto shops using air sampling and biomarkers with Diana Caballos, PhD, MS, CIH. For more, you can visit us online at coeh@berkeley.edu/webinars. And on behalf of education and research centers throughout the country, it's my pleasure to welcome you to today's series. This is a collaborative effort on behalf of each ERC's continuing education program and aspires to provide access to current research that's being supported at NIOSH ERC programs and participating universities. Today's webinar, Positive Psychological Functioning, Work and Health, is presented by Hayami Koga, MD, MPH, PhD, and the New York, New Jersey Education and Research Center. I do have a few housekeeping announcements before we get started. You are going to be muted during this presentation. If you'd like to ask a question, you can enter it into the online Q&A box, and we'll save time at the end of the presentation to address as many questions as possible. We're also going to have the chat open, so feel free to use it to participate and join in on the conversation and share resources with one another. This presentation is being recorded and will be made available on the Center for Occupational and Environmental Health YouTube page within 5 business days. And all participants who log in today with their registration email for the full live presentation will receive an email with a link to the evaluation form that will qualify you for a certificate of completion with 1 continuing education contact hour. Once the evaluation is completed, you'll be able to access and print your certificate. And without further ado, it is my absolute pleasure to welcome our presenter for today, Hayami Koga, MD, MPH, PhD. Dr. Koga is a postdoctoral fellow at the Harvard Center for Population and Development Studies. Her research focuses on whether positive psychological functioning at a population level is an important asset that contributes to a longer and healthier life. She is also interested in how the workplace can be a critical environment for shaping health and well-being across the life's course. She holds a PhD in Population Health Sciences from Harvard University and an MD from the University of Occupational and Environmental Health in Japan. Thank you so much for joining us today and sharing your research. We're really looking forward to your presentation.
Thank you, Michelle. I'm going to start off with sharing my screen. Okay, that works. Okay, thank you very much for the introduction, and thank you for inviting me to give a talk about our work today. My name, again, is Hayami Koga. I'm a postdoc at the Harvard Center for Population Development Studies. And today, I'd like to share some of our work, primarily looking at the associations between positive psychological functioning and health, and recently, increasingly with work, which I will talk about towards the end of my presentation. Okay, to start off with, I have an overview slide to motivate the work. Life expectancy has increased over the past decades, and the dark green line is the world average here, and we see that this trend of increase is seen across all regions. I think there are many reasons why life expectancy is increasing, and part of it may be due to public health and medical research identifying risk factors for diseases and mortality like smoking, infectious diseases, and of course, environmental factors. And these studies have focused on identifying the negative risk factors that can lead to worse health. However, there's increasing research suggesting that there are also positive factors, such as positive psychological functioning, which include things like optimism, purpose in life, that may also contribute to better health. My work looks at psychological constructs like optimism and how it may be associated with better health. So for today, this is the outline of my presentation. First, I'd like to start off with talking about what exactly is positive psychological functioning. And then I'd like to introduce some of our work looking at the associations between positive psychological functioning and health. And then I'll talk about some of the mechanisms linking positive psychological functioning and health. Introduce some of our work there as well. And lastly, I would like to talk about the interventions that are suggested to increase levels of positive psychological functioning, and about some organizational level factors that we might be able to consider to increase levels of positive psychological functioning, including workplace factors. So, starting off with what is positive psychological functioning? Here's a figure with emojis to help explain this. Positive psychological functioning is commonly interpreted as the absence of distress or other negative factors, which would be this middle emoji here. However, the absence of these negative factors is not the same as the presence of the positive factors, and I think it is more than that. For example, not being depressed is not the same as being happy. So positive psychological functioning is more than the absence of negative psychological factors. So to give you some examples of the constructs of positive psychological functioning that are commonly studied, I like to start with talking about the negative psychological factors, which are on the left in the blue box over here. Negative psychological factors, including things like depression, anxiety, anger, negative affect, and distress, are amongst the ones that are most commonly studied. And on the positives in the yellow box here, you have things like optimism, purpose in life, life satisfaction, positive affect, happiness, and the list goes on. But these are some of the ones that are most commonly studied. These facets of positive psychological functions, although may seem similar, do not necessarily travel together in data, and they are not the same. So, moving on to, is positive psychological functioning associated with better health? Again, I'd like to start by talking about the negative psychological factors, as it may be a little bit more familiar to some of us, and their associations to physical health. And these negative psychological factors have been studied quite extensively in relation to various health outcomes, including cardiovascular diseases, diabetes, arthritis, hypertension, physical functioning, mortality, and many other health outcomes amongst them. And these studies are represented in this figure here, where the studies look at the association between negative psychological factors and poor health. And in comparison, our studies look at the opposites, whether the presence of these positive factors are associated with better health. And some people may think that if the top association is true, the bottom must be true because it is the flip side. However, it's important to note that the bottom association is not simply looking at the flip side association. And this is because we're actually looking at the association beyond the absence of these negative factors, by adjusting for the negative psychological factors, often by adjusting for things like depression, to see if the association is there even after taking account of these factors. So out of the various constructs of positive psychological functioning, we have primarily focused on looking at optimism and purpose in life. So I will mostly talk about these constructs in my presentation today. So the studies I will introduce today have a prospective study design where we measure positive psychological functioning at a given time point when individuals are likely healthy, and then follow individuals to see who remains healthy or who develops a disease. That's the general design of the studies that I will talk about. Important to note that we account for factors that could explain away the association we see, including social demographics like age, sex, race and ethnicity, marital status, and education. Also, we account for things like baseline health status to address potential reverse causation in which health affects optimism levels. And also negative psychological factors, as I mentioned before, to see if associations are seen above and beyond the absence of these negative factors. So the first study I'd like to introduce is a study that looked at optimism and its association with longevity as an indicator of health. So this study was published in the Journal of American Geriatric Society in 2022. And just briefly, the methods, we use data from the Women's Health Initiative, which is a longitudinal cohort of postmenopausal women in the US. The sample size was 159,000, and we have a good size of race and ethnic groups, which is a benefit of using this WHI data. Baseline age is 63 years old. As measures, the exposure of optimism was defined as the general expectation that good things will happen, and we use the life orientation test revised, which is a commonly used and well-validated measure of optimism. This measure has 6 items, including things like, in uncertain times, I usually expect the best, and if something can go wrong for me, it will, which is reverse coded. The scores are added to calculate a total score of optimism that ranges from 6 to 30, and then we standardize this score for ease of a comparison with other studies. As statistical analysis, we measured optimism at baseline and followed how long individuals lived for up to 26 years of follow-up. We use accelerated failure time models, which is a type of survival analysis, and adjusted for a range of covariates, again, including things like age, race and ethnicity, education, income, chronic health conditions, depressive symptoms. Yep. And here are the results. On the x-axis, we have optimism categorized in quartiles. We have those with the lowest levels of optimism as the reference group, and those with the highest levels on the very right in quartile 4. Y-axis is the percent increase in lifespan, and we can see here that compared to those with the lowest levels of optimism, those with the highest levels of optimism had about a 5.4% longer lives. And this translates to about 4.4 years of extended life for women in the US. When we stratify by race and ethnic groups, we see that the results are largely similar across groups. The blue, the dark blue, is the full sample. The orange is for white women. The gray is for Black women. The yellow is for the Hispanic Latino women, and the light blue are for Asian women. And I think we can say that the association between optimism and lifespan are seen across race and ethnic groups, suggesting that optimism may be beneficial across race and ethnic groups. So now that we know that optimism is associated with longer life, the next question we had was if this extended life is accompanied by health. So is optimism associated with healthy aging, not just longer lives? And I think there are various ways we can measure healthy aging, but in the next study, we use objective measures of physical functioning as a proxy for healthy aging. This was a paper published in JAMA Psychiatry. And we had 3 hypotheses for this study. Hypothesis 1 was higher optimism levels are associated with better baseline performance of physical functioning and slower rate of decline over time. This is to look at the full spectrum of physical functioning. And then hypothesis 2 was that higher optimism levels are associated with extended time to reach impairment levels of physical functioning. This was a more clinically relevant outcome. We used impairment levels that predict other adverse health outcomes using previously identified thresholds. And we also wanted to see if these associations are seen across race and ethnic groups. Again, we use data from the Women's Health Initiative. In the Women's Health Initiative, a random subsample of women aged over 65 completed performance-based physical functioning tests at clinic visits. So we used this subsample for this study. Sample size was about 5,900. We used measurements of optimism and physical functioning at baseline. And then we had repeated measures of physical functioning at 1 year, 3 years, and 6 years post-baseline. As measures, the exposure of optimism was the same as before. The life orientation tests revised. And for the outcome of physical function, we had 3 different performance-based measures. We had grip strength, which was measured by a dynamometer on the dominant hand in kilograms. Time walked, which was the time taken to walk 6 meters, measured in seconds. And chair stands, which was the number of chair rises that were able to be done in 15 seconds. So covariates, we considered a wide range of covariates as potential confounders at baseline, and these included sociodemographics, health conditions, and health behaviors like smoking, alcohol consumption, diet quality, physical activity, and BMI. Some of these could lie on the pathway from optimism to physical functioning, but we included them as confounders only due to data availability. So a statistical analysis for hypothesis one, we use generalized linear and mixed models to see if higher optimism levels are associated with sustained levels of physical functioning over time. For hypothesis two, we use Cox proportional hazards models to assess if higher levels of optimism are associated with extended time to reach impairment levels of physical functioning. We have thresholds for impairment based on prior work. And we tested for interaction by race and ethnicity to see if the associations are similarly seen across these groups. And here are the results for the GLMM, where we looked at the association with optimism and declines in physical functioning. This is the fully adjusted model that is adjusted for demographics, health status, depression, health behaviors, and BMI. And first, for grip strength, this blue arrow indicates the direction of strength. The higher the number, the stronger the grip strength. In red here, we have the coefficient for optimism, adjusting for these covariates. Higher optimism was associated with stronger grip strength. And in blue here, we have the coefficient for time. As we expect, this is in a negative direction, meaning that for every year, grip strength decreased. And in green, we have the coefficient for the interaction term for optimism and time. We saw no significant interaction for grip strength. And we saw similar associations for models that adjusted for less covariates. Moving on to times walk. Now we would expect to see things go in the opposite direction because shorter time to walk 6 meters is faster. So we have to switch our mind a little bit here. We see in red the coefficient for optimism is not statistically significant. In blue, we have the coefficient for time. We see that every additional year of time is associated with more time to walk 6 meters. And in green, we have the interaction term, and we see that there is a significant interaction in the direction we expect. A 1 standard deviation increase in optimism is associated with a 43% slower rate of decline in walking time each year. And then finally, for chair stands, we again have to flip our thinking again. We have, so we go back to the direction for grip strength. The more chair stands, the better functioning. So we see that there's a significant association between optimism and number of chair stands here at baseline. And the coefficient for time is what we expect. Over time, people are doing less chair stands, and the interaction is also seen in the expected direction. So a 1 standard deviation increase in optimism associated with a 9% slower rate of decline in the average number of chair stands performed. And so we have a lot of results here, but to summarize, we see baseline associations for grip strength and chair stands and associations with the rate of change for time block and chair stands. And we found no evidence for interaction by race and ethnicity. And here are the results for the association between optimism and time to reach levels of impairment for these 3 measures. For grip strength, we see in model 1, where we adjust for age only, a 1 standard deviation increase in optimism is associated with 16% lower hazards of reaching levels of impairment. This means that those who were more optimistic had extended time until they reached levels of impairment. And associations were seen in subsequent models that further adjusted for covariates. We see similar associations for walking speed and also for chair stands. We also found no evidence to suggest that there is interaction by race and ethnicity in all models. Okay, so we have looked at other psychological constructs like purpose in life and its association to other objective measures of physical functioning. Here we looked at Parkinsonism specifically, where we also found some interesting findings. And it does seem like optimism is associated with not only longer, but also healthier lives. So moving on to the third topic of mechanisms linking psychological functioning and health. This will be about the pathway here between positive psychological functioning and health. And I think it's important to think about the mechanisms because it strengthens the evidence, but also because some people are quite skeptical of such studies, and being able to explain some of the mechanisms helps with making the case that there is an association. Studies suggest that there may be multiple mechanisms underlying the association, and we like to think of the mechanisms in 3 big buckets. Bucket one is health behaviors. Bucket two is biological processes, and bucket three is psychosocial factors. Starting with health behaviors on the very left here, studies have shown that positive psychological functioning is associated with things like increased physical activity, not smoking, healthier diets, better sleep quality, and increased use of preventive healthcare use services. And these may be one mechanism leading to better health. So more better psychological functioning, better health behaviors, and then therefore better health. And in the middle, we have biological processes. Positive psychological function has been linked to healthier lipid profiles, things like lower inflammation, lower blood pressure. These healthier biological processes may be leading to better health. On the very right, we have psychosocial factors. Studies have shown that those with higher levels of positive psychological functioning are more likely to have more social support, maybe better at regulating their emotions, or it may also buffer stress, which then may lead to better health. So we have looked into some of these mechanisms, so I'd like to introduce some of our work that explored some of these mechanisms. So coming back to the first study I introduced, where we looked at the association between optimism and lifespan. As part of the study, we looked at how much of this association is mediated by health behaviors. So we looked at the proportion of the association between optimism and lifespan that is explained by health behaviors by using causal mediation analyses. This is a method that is able to deconstruct the effect into the proportion mediated by health behaviors and the proportion mediated by other factors. So for this, we created a lifestyle score based on things like diet, quality, smoking status, physical activity, alcohol consumption, and BMI. And we categorized each as healthy and unhealthy based on predefined cut points. And we looked at the effect of optimism on lifespan that is mediated by this lifestyle score, which was measured 3 years after the measurement of baseline optimism. So, and here are the results. The dark blue here, again, is the full sample. The effect of optimism on lifespan was mediated by lifestyle scores by about 24% in the overall sample. And this also was seen across race and ethnic groups. So there does seem to be some differences by groups, and such differences could be due to the variation in the extent to which individuals from these groups have opportunities to engage in healthy behaviors. For example, not all may have equal access to healthy food or safe environments to exercise. But these differences need to be interpreted with caution, as the groups with smaller sample sizes did have larger confidence intervals. And more exploration of these differences is needed, but overall we see similar findings across race and ethnic groups. Okay, and then here is another study looking at one of the biological processes as a potential mechanism. This is a cross-sectional study that looked at the association of optimism and purpose in life and immune markers in aging. So more specifically, the study looked at immunosenescence, which is the age-related changes in the immune system. Immunosenescence contributes to the etiology of various diseases that increasingly occur with age, including cardiovascular disease, neurodegenerative diseases, cancer, and infectious diseases. And there are several immune measures that are associated with immunosenescence. In particular, immunosenescence can be characterized by changes in the T cell subsets, which are lymphocytes that play an important role in fighting off antigens. And recent work has also identified that cytomegalovirus plays an important role in this process of immune aging as well. And so we looked at these indicators of immune function as proxies for immunosenescence. In the interest of time, I will only talk about T cell subsets today, and which is also where we had some interesting findings. And T cells are a type of lymphocytes that are part of the adaptive immune system. And this figure shows the differentiation of T cells as they mature from the naive cells to the memory cells. With age, we have a shift in these cells towards the right, the terminally differentiated cells. So there is a decrease in the naive T cells and an increase in the terminally differentiated effector memory T cells. The proportion of these cells indicate the aging of the immune cells. And in the study, we looked at the proportion of naive T cells for CD4 and CD8, and the terminally differentiated T cells for both CD4 and CD8 cells, as well as the CD4 to 8 ratio, which is also known to shift towards more CD8 cells with age. So we hypothesized that higher levels of psychological functioning is associated with T cell subsets, subset distributions indicative of slower immune aging. Specifically, we expect associations with higher proportions of naive CD4 and CD8 T cells, lower proportion of the Temera CD4 and CD8 cells, and higher proportion of CD4 T cells relative to CD8 T cells. So data were from the Health and Retirement Study, a longitudinal cohort of men and women in the US aged 50 and older. And in 2016, the respondents were asked to participate in a venous blood draw study. And so we used this data. Average age of these participants was 70, and the analytic sample ranged in the 7,000s, depending on the outcome we looked at. This again was a cross-sectional study due to data availability. Outcome measures again were the T cell subsets, CD4 and 8 naive T cells proportions, and the Temera CD4 and 8 T cell proportions, as well as the CD4 to 8 ratio. And here are the results. I will show the results just for the association between purpose and life and the T cell subsets here. But if you're interested, you're more than welcome to go to the paper to look at the other results. The bars in red are the coefficients for each of the T cell subset outcomes adjusting for age only. So this is the model one. Coefficients to the right of the null bar, we see here the line going vertically. So coefficients to the right of this bar indicates that higher levels of purpose in life are associated with higher proportions of these cells. So we would expect the naive cells and the CD4 to 8 ratio to be on the right side of this null bar, but the Temera cells we would expect to see go in the opposite direction. So we would expect them to be on the left side of the null bar. So we see that increments in purpose in life were associated with higher levels of CD4 naive, CD8 naive, and CD4 to 8 ratio in model 1. And when we increasingly adjusted for covariates, associations maintained only for CD4 naive T cells. For the CD4 and CD8 Temera cells, we found no significant associations across all models. And so it does not seem to be a major mechanism, but a hint of something that might be happening in the immune cells as a potential mechanism. Okay, so I'd like to move on to the last topic of today, the interventions to increase positive psychological functioning. So we will now be shifting our thinking a little bit, now from thinking about positive psychological functioning as an exposure to thinking about it as more of an outcome for interventions. And I like to use the social ecological model for behavior change when thinking about the interventions, ranging from the individual level, interpersonal, community, organizational, and policy environmental levels as we go broader. There are things we can do at each level, and most of the research on interventions have been done in the field of psychology, which I believe is often an individual level field of study. But these individual level interventions include things like visualizing the best possible self-intervention, which is where you identify goals and then imagine a future in which everything has turned out well and the goals have been reached. You could write this down and visualize this on your own. Or things like performing acts of kindness, which is where you choose a day in a week to do a few random acts of kindness. And then also things like practicing gratitudes, which can be done by writing gratitude letters and giving this letter to the person you wrote it for, or you can keep it to yourself. And these interventions have been shown to be effective in raising levels of positive psychological functioning with randomized control trials. But the effect sizes do seem to be quite small in these intervention studies, so it's questionable whether these intervention effects are large enough to lead to better health. And given that positive psychological functioning seems to be beneficial for health, as we saw in the studies I introduced, and as it seems to be beneficial for health across diverse groups, as public health professionals, I think it's important to think a little broader, and to think about what can be done at higher levels, like at the organizational level, at the community and policy, environmental levels. And I think companies and governments are now increasingly interested in measuring and intervening on these positive psychological functioning, or well-being. So I think this is something that has a room for a lot more research. And some of my recent work is trying to look at the organizational level by thinking about workplace factors that contribute to positive psychological functioning and also health. And the workplace is where many adults spend most of their working hours, so I think it's a very effective point of intervention. And while work can pose as a risk for health, it can also be an opportunity to improve health and well-being. And the traditional job demand control model, which some of you may be familiar with, that considers things like work demand and how much control one has over their work, is one framework that can be used to think about this. But I think we can go a little bit broader than that. And I've used the positive factors mindset here. For example, there's the Surgeon General's framework of workplace mental health and well-being that was proposed in 2022 in response to the COVID pandemic. This framework includes things like opportunities for growth, mattering at work, work-life harmony, connection and community, worker voice and equity. And I think this is a nice framework to start thinking about the factors that might be targets for interventions for worker well-being or positive psychological functioning. So, and this I'm presenting for the first time to anybody, but this is still at a very preliminary stage, so please keep that in mind. And it's unpublished work, but based on the Surgeon General's framework, we have been collecting data in service workers in Japan. We have looked at the association between these workplace positive factors and mental health. We assessed multiple dimensions of positive workplace factors, including the factors mentioned in Surgeon General's framework, and we created a score. And we found that the score was associated with lower psychological distress, higher life satisfaction, and higher optimism. We also looked into whether they are associated with physical health as well, including better and we did find associations with better self-reported general health, cardiovascular health, assessed by biomarkers, including things like cholesterol levels, blood pressure, and also physical pain, which is something important for service workers, especially. I'm still beginning to explore this area, but this may be a hint that strengthening these positive workplace factors could contribute to better health and well-being of workers. And that is all I have prepared for today. Here are the acknowledgements. And I thank you very much for your attention. Here's my email and website if anybody is interested in connecting. And I look forward to the discussion and the Q&A. Thank you very much.
Thank you so much for your time and for sharing this information with our audience here today. We do have plenty of time for Q&A, so I invite you all to enter your questions into the Q&A box at this time. The first question that came in, did you look at the role of work on optimism and psychological functioning? Does optimism impact worker well-being and health? Are there differences in occupations, blue collar versus white collar jobs or entry level versus management jobs? Have you looked into any of these factors?
So, to be honest, this is really something of interest and something that I have just started to explore. So I haven't really looked by worker. And well, the first question, the first part was whether optimism is associated with work. Sorry,
So I'm sorry, I read a lot of questions at once. Did you look at the role of work on optimism and
I
psychological functioning?
yes. So yeah, that definitely is something I would be interested in. Sorry, I don't have a straightforward answer, but if I have, although I some of the work I did recently was this wasn't optimism, this was more about happiness, life satisfaction, but it did show that employment status did matter a lot. People who don't have a job are less likely to have higher levels of these well-being constructs. So I believe this was also true for optimism, but I think this is not like a more detailed nuance of work characteristics, but just talking about worker like occupational status, at least that matters a lot. So yeah, something that I would be interested in looking at more for sure.
Thank you so much. This was a question about T cell aging. If I was tracking properly, it seems that the T cell aging affected by positive mindsets, could that mean that other blood cell effects are there too? If so, would there be any future studies for positivity and effects of, for example, cancer-forming cells?
Right. Great question. I haven't looked at cancer forming cells specifically, and this was something I did part of my dissertation, and a lot of the cells, um, a lot of what I looked at was determined by data availability, sure. So I think, given that we did find some findings, I think looking broader to other cells would be the next step. I haven't gotten to doing that, but for sure something that would be interesting to look at. And but one thing I did want to mention, so studies looking at optimism and cancer do have mostly not found significant findings. It does seem to be that optimism is associated with more so with cardiovascular health, but also with mortality and other long-term outcomes. But I think cancer is something that's a little less strongly associated. So, but these studies haven't looked at cells per se. So I think maybe looking at the cells might change the findings. It's something that would be super interesting to look at.
Thank you so much. Are you aware of any studies on how mindfulness-based stress reduction programs in workplaces intersect with your research?
Am I aware? Was that?
Yeah, are you familiar with the mindfulness-based stress reduction programs and have you seen any research of that kind of intersecting with what you do?
Right. So I don't look at mindfulness per se, but I'm sure this would have relevant findings. I think I showed the individual level interventions. I think mindfulness would be one of them, I think. And yeah, it'll be interesting to see if work is also related, but I think I try to think a little bit at a broader level in terms of interventions, like if there are things in the workplace that can be a little bit more structural than asking people to, sit down and meditate, because I feel like this it's a little bit too individual focused. And studies do show that it might not be as effective. And there's also like a thing of like putting the burden on the individual versus, doing some more structural changes. So I think I prefer the structural organizational level interventions, but I think, yeah, mindfulness, of course, would be like a something that would be interesting to look at in terms of intersection.
And this question kind of also touches on that difference between the individual level interventions versus the more systematic population level studies that you're doing. But someone was asking if Are there any studies or interventions that you've seen around, say, someone who might have not be an optimistic person, helping them transition into framing a more optimistic mindset, to try and get some more of those benefits?
Right, yeah. So studies show that about like a quarter to about less than a half of, for example, optimism is inherited. So it suggests that more than half of it is environmental, so, which indicates that it likely can be changed with interventions. And I think the most studies individual level interventions were the ones that I listed in the slide where I had a few of the like the best possible self-intervention, and these are have shown to be effective in changing levels of psychological functioning, including optimism. So it proof of concept, it does seem to be that people can change levels of optimism. Also, there's psychotherapy for sure, which is a more intensive way of changing people's levels of optimism. It's this, we call it a trait. So it's not something that fluctuates by like day or by month, but it's a trait, but it is also something that is modifiable with active and intensive intervention.
Thank you so much for sharing that. Yeah, it's really interesting to reflect on, if it is a trait or if you can modify it. I'd be
Right.
interested if there were studies kind of like pre-intervention and post-intervention. I know, again,
Right.
I'm getting down to the individual versus the population level, but
Right,
it's
right.
great
There are
conversation.
also studies looking at pre-post with interventions, and it does seem to be modifiable.
Yeah, that's really great. Thank you. Are there any practices you recommend employers implement?
Right.
Managerial positions?
Right. So I think so. I don't think there's too much evidence there yet, although the Surgeon General's framework is something I find very helpful in thinking about some of the things that we can think about, like worker voice, encouraging employees to voice their concerns or their thoughts on how work is done. And there is some evidence there around how that does increase the well-being of the workers and other things like there's also a good body of work looking at schedule predictability, schedule flexibility of the workers, and how that is associated with better mental health. And yeah, I think the framework is something that is quite useful in trying to think about what can be done. And I think for sure more evidence needs to be made to, encourage employers to make some changes in the workplace. Definitely something I will be doing in the next few years. And I think if you could ask me the same question in a few years, I would have more of a better answer.
Amazing. Thank you. And a comment, I really love that WARE framework, so thank you for sharing it.
Thank you.
Was the decreased percentage on life, was there, or have you found a decreased percentage on life expectancy with less optimistic people?
So do you mean, I'm not sure, like
The
the
way, I guess the way I'm interpreting this question is that for those who are less optimistic, do you find that they have a lower life expectancy or shorter?
Yeah, I think if you flip the findings, that would translate to lower optimism associated with decreased life expectancy, if I'm understanding it correctly.
Another question. In some countries, workers start the day with group physical exercises. Has this been studied or measured at all to be effective in increasing life health span and optimism?
That's a great question. I don't really know specifically, but I'm sure there's some evidence there, and I feel like it is a good way to encourage not just the constructs mentioned in the framework, the Surgeon General's framework, but I think it would encourage things like workplace social cohesion, doing like this group exercise might be beneficial in that way. It would be interesting to see if there's an intervention effect there as well.
Thank you. Has anyone looked into the impact of workload and its hardships and like physical workload and how that might intersect with some of your research?
Sure. I think this would be more of the traditional job demand control model, a Karasek's model, and how that's associated with worse mental health and worse physical health. But looking at the intersection between these positive factors and these workloads, work demands, I think is something that I would be interested in doing. I haven't done this yet, but for sure, yeah, looking at how the positive factors might buffer these negative effects is definitely something worth looking at.
Thank you. And this actually ties right into the next question. What areas in positive psychological functioning and health do you think are most in need of attention over the next 5 years?
Oh, great question. I don't have a straight up answer, but I think the whole everything.
Smorgasbord.
I think since we're in an aging society, age-related outcomes is something I've been interested in looking at how to encourage people to stay healthy and live a healthier, not just longer, but a healthier and longer life. So something in this area would be relevant to countries like the US and also to Japan, where we're a very aged society.
Thank you. Are you also able to speak a little to what accounts for difference in optimism by race or how that intersected with your research?
Sure. So this depends on the study, I think, but generally there isn't too much of a racial difference in the levels of optimism. There might be some subtle differences, like in the paper in Journal of the Geriatric Society that this study was published in. I do have some figures showing the distribution of optimism by race. But in general, it's not too different by race. What is important is that although there might be some racial and ethnic differences, our point is that the fact that the association is seen across these racial and ethnic it's not just that that association is only seen in white populations. It's also seen in Black women, also in white, in Asian or Hispanic Latino women. The fact that this association is seen across these groups is what we find as a very encouraging finding. So that this is relevant to um, racial and ethnic minority groups as well. It's something that might be beneficial to health, even if we might not have the same levels of optimism to start with.
Thank you. What are some of the biggest barriers you see to scaling positive psychological interventions, and how might we overcome them?
Right, barriers. I think if it were if I think that this would depend on which level of interventions we would think about, and something at the workplace at least would be, trying to involve the workplace to the employers to be on board with such interventions, I think might be the biggest barrier. Also, the workers might not be too, interested in making any change in the workplace. I think it takes involve and encouraging the employers to, encourage their workers and think although if we do have sufficient evidence and findings to show that doing this will have benefits to the workers and to the company as well, is something that would might help people to be on board with such interventions. And I think, yeah, intervention studies would definitely be something down the road that I would be interested in, although that would take a lot more cost and effort. So something, a big project in down the road, I think.
Yeah, I imagine also the time intervals involved in doing a large study like that.
Right.
Yes, a very important area of study and also funding for research
Right.
studies.
Yeah. It
Yes.
would be ideal to if we could have some
Yeah.
intervention studies. Yeah.
That's great. Well, in this kind of ties into the intervention studies, but goes back to something we were talking about a little bit earlier, going back to changing behavior and encouraging more optimistic mindsets. Is that something that there's been studies that show as someone does work to become or to to change themselves to be a little bit more optimistic, that you're able to see changes in that blood work and some of those markers that you were sharing with us?
Right. So I think ideally, we would want to study that, we intervene on positive psychological functioning, and then we see changes in health. But I think, at least to my knowledge, there aren't very many studies that do that. That takes a lot of, so I think a lot of the intervention studies intervene and see if the psychological functioning changes, and they're not able to look up to the changes in health because that takes a lot more time and more intensive interventions. I think if we were able to show that, it would be ideal. But I think a lot of the studies look at just the intervention effects and also just the associations of positive psychological functioning and health, and kind of trying to draw the picture that this should theoretically be the case, that intervening will increase health. But technically, I think we would need better studies to prove this principle.
For sure. Thank you. We got a couple more questions here, and again, we do have a few more minutes, so if anyone has questions, please do feel free to enter them. Um, are there any metrics or indicators that you think organizations should be tracking to help evaluate the impact of psychological well-being programs?
Right. I think so I'm not too familiar with what exactly companies are measuring right now. At least if I can speak to Japanese companies, they do they have like this annual stress check where they do measure levels of stress, and some of the workplace constructs like uh, supervised support and some of the positive factors, but not very many. So I think incorporating the positive factors, coming back to the slide where I talked about the absence of negative is not exactly the same as the presence of the positives. I think incorporating measures that actually try to measure the positives, I think would be a good place to start, because I don't think many companies do this. Maybe companies in the US do, but at least in Japan, that's not the case. So I think that's something they could start with.
Awesome. Thank you so much. Another question, just kind of noting, as you think about the course of a lifespan, and noting that it's optimism is an inherited trait and is hypothetically something that we can also shift. Um, are you aware of any particular life stages or, work-life transitions or I guess inflection points in which the positive psychological functioning is especially impactful?
Right. So I can't speak to the exact time where, it changes the most. I think it's very hard to study that. But one thing I can say is that education is a big factor for levels of at least optimism. Like no matter the data, we always see a gradient in optimism by levels of education, which suggests that early life stages, like educational, like where people get education, is an important phase in life, where people's levels of optimism or positive psychological functioning get developed. But it also speaks to the fact that maybe even after adulthood, you know, giving people opportunities for learning new skills, not necessarily um, formal education, but like uh, something similar to education, like of training, skill sets. These opportunities might also change levels of optimism or psychological functioning. So something that needs to be studied for sure more, but just wanted to mention that education is is a big factor. So something that could potentially be a good target for interventions.
Thank you. Yeah, I think that also kind of ties into some total worker health related research around, in systematic like systems ergonomics, kind of looking at how do you keep employees engaged, helping people challenge themselves, learning new skills,
Hmm.
et cetera, all ways that improve the mental health and well-being in the workplace. So it makes sense that you'd bring up education as a factor. Thank you for
Oh,
sharing
great.
that.
Yeah, thanks for bringing that out.
Very cool. Another question, to what extent when you were looking at, I guess, co-founding factors, did you integrate also looking at smoking and secondhand smoke, those kinds of, I guess, lifestyle, whether firsthand, secondhand smoke as in impacting the psychological functioning markers that you were looking at and like blood levels and those sorts of things?
Right. So for all the data that I use here, we don't have information on secondhand smoking, but we do often have information on the participants' smoking status, and we do account for that. And oftentimes findings don't really change even after accounting for these health behaviors and other health behaviors like physical activity, diet, and so on.
Awesome. Well, thank you so much. I think that kind of concludes the questions that we had from our audience. But in closing, is there anything else you'd like to share with us? Maybe what you're hoping to do next in terms of your research?
Right. So I think my next steps are definitely to getting in deeper into the workplace. I do have a background in occupational medicine, so kind of combining my two fields of studies, the psychological well-being and occupational medicine, to think more about workplace as a potential place for intervention. So I did show some of my preliminary work, but I think I will like to delve much deeper into the workplace. And if anybody is interested in collaborating or have any thoughts, I'm more than happy to, talk to anybody. And I'm always open for collaborations and, looking forward to connecting with everybody offline as well.
Well, thank you so much. And I'll call out one of the comments, spread positivity to prolong our lives. Such
Yeah.
a relevant study. Thank you so much for sharing your research with us and conducting that research and really helping to make those links. Very important stuff. We really appreciate it.
Thank you very much. Thanks so much for your time. Thank you.
Awesome. And so thank you, Dr. Koga, and thank you everyone who joined us for today's session. And be sure to check us out online for more information and to register for upcoming events. As a reminder, this webinar was recorded and will be made available on our YouTube page within the next 5 business days. Thank you again, and I hope you all have a wonderful and optimistic rest of your day.
Thank you. Have a
Take
good
care.
week.
Bye-bye.
Thank you. Bye.